During the pandemic, Loyola University Health System was presented with the opportunity to expand testing through a pop-up testing laboratory. Working together with hospital executives, pathologists provided their laboratory medicine expertise to guide the establishment of the program. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. Join us to hear how Loyola University Health System's new laboratory approach during the COVID pandemic was able to broaden communication and collaboration between clinicians and hospital leadership, improve patient outcomes and streamline process efficiencies while also increasing visibility for the system, and reinforce Loyola as a premier resource for diagnosing and treating illnesses. Today's podcast is brought to you by the College of American Pathologists.
Good day. I'm Elisa Adespapachaga with the American Hospital Association, and joining me today, Dr. Eva Vocic, Chief of Pathology and Laboratory Medicine and Regional Laboratory Officer at Loyola Medicine, and Jonathan Baxt, Regional Administrative Director, Laboratory Services at Loyola University Health System. So Eva, let me start with you, and really from a clinical perspective, tell me a little bit about the work that you've been able to do. I mean, we've definitely seen the healthcare field needing to think outside the box, develop new procedures to do almost everything as a result of the pandemic. And you have done a lot of work to expand testing through your pop-up lab. So can you tell me a little bit about how this opportunity came about and the significance of the work of what you did?
First of all, thank you very much for the opportunity to talk about our experience during this really very challenging times. When you really think about this, is only 2 years ago, and it seems like a lifetime. All of us faced with this unknown virus, our life flipped upside down overnight. The virus, which none of us really had any idea what it is, how to test it, how to detect, and we have to come out with the solutions practically overnight. And I think this is really the best example what we are able to do. Before I'm going to even start talking about the pop-up labs, I just want to let you know that we here at Loyola, we started testing in-house on March 19th, really within the hours after the testing from Abbott got this temporary approval from FDA. So that was really, I think, truly amazing testimony how great this lab is to do this in such a short time. And after, so we were more or less taking care of our patients through just regular testing. The next step was, of course, that was spring. And in the summer, we needed more testing. Everybody wanted to be tested. Everyone wanted to be tested. All of us remember. And the most important, our students needed to be tested because the universities were closed, medical school was closed. So that was the issue right now. What kind of testing can be done for those students? And that was those days when each and every lab wanted to do some testing. Everyone wanted to do the testing. And the tests and sites were popping up everywhere. So for me, it was very important. For us, it was very important that the test has to be done in appropriate environment and conditions and by people who are doing this for living, meaning laboratorians, meaning us. So the opportunity came across to collaborate with the University of Illinois, which started that SHIELD program, saliva testing, and we became one part of that whole enterprise. We were one of the very first one in Chicago to serve mainly our students and our community of significance. So that's again, I felt very strongly that it has to be done under proper laboratory conditions. And during all this pandemic, when all this other testing were still going on and we were introducing new platforms, we created a completely new lab within 6 weeks. And of course, John can tell more details how it was done and how it was even possible to do this.
John, that's a perfect opening. Tell us a little bit about, from the administrative perspective, how you put this all together in 6 weeks.
Thank you very much for having me on to talk about our experiences. And I think, start with, I think the term pop-up lab does not do what we did justice. In this partnership of University of Illinois and Shield, Illinois, we look at this, as a great opportunity for us to, as Dr. Wojcik had mentioned, bringing students back to school, bringing employees back to work. And so we want to take this upon ourselves to really lead this from our Loyola Medicine standpoint, from a clinical laboratory standpoint. And so we worked with our senior leadership team to get an agreement done in a matter of months with Shield, Illinois. And so we signed an agreement in December 2020, and we were able to conduct our first test 6 weeks later. Really a Herculean effort by all parties, looking at, this involved legal, HR, our facilities team, and our laboratory operations team, and really to get everything up and going within a matter of weeks, have a full validation complete so that we were ready to test and really support, the needs of the community and the needs of the students around the Chicagoland and Illinois state.
And if I can add a little bit.
Go ahead.
Thank you, John, for pointing out that using the pop-up lab, it doesn't give it justice. Because that's exactly what we truly wanted to avoid. Because, yes, theoretically speaking, to create a lab, it's not a big deal. You get a box, you start taking samples and run through this, and that's it. The box will spit out your results. It's obviously much, much, much more complicated. And, it took even this legal part and logistics, how create how those tests are obtained, how they are being reported, and the most important, to validate, to make sure that everything works properly. It's extremely important for any lab test. Lab is a very complicated enterprise. It's not only doing the testing, but all this pre-analytical, post-analytical issues are overall, even more complicated than testing by itself.
Absolutely. And I was going to say, you really require partnerships. You are one of the departments that touches everyone in the hospital and in the broader community. You really require partnerships and relationships both within your own organization, and you mentioned those with institutions outside. How are you able to build some of those relationships? I'm assuming some of them came from the ones that you already had, as your lab has interacted with a broad spectrum of your organization. But how were you able to navigate some of those relationships and broaden them and tighten them so that you could do this work? Dr. Wojcik, let me start with you again.
Well, that's exactly what you just mentioned, that some of those relationships, they already existed. I mean, most of those relationships existed. Lab is a critical, integral, basic part of any healthcare system. No healthcare system can exist without lab. And that's why we are part of the team. So we have to work very closely with our administration, with our senior administration, with our leaders, for them to understand the significance of lab. And we are, I would say, very fortunate here at Loyola to say that we are working very closely. I think administration leadership truly trusts us and we know what is really needed. And I think everybody did see an opportunity to create that lab, opportunity to provide the testing for our students, for the university, for the community, for our employees. And it didn't happen overnight. I think to have this kind of trust, we have been working for years and years. And just to let you know too, that the best testimony about the trust, all of this happened, COVID, while we were building a new regional lab. So as I always keep saying, one of the projects, meaning regional lab, one project, overall COVID testing, another project, this additional lab is the third project. It's big enough for somebody's lifetime. We went through this simultaneously within the same time, and all of them, I would say, pretty successful. You learn what you are able to do at the time of the crisis. And I think we have shown to everyone what we are capable of.
Absolutely. It really sounds like you've had quite a lot on your plate. John, let me turn to you. As you sort of looked at seen the success of this pop-up, and I will almost put it in air quotes, this amazing new process and lab that you created as one of the projects. How have you seen some of the perception among your colleagues change and the leadership within the hospital about the lab and its importance? I don't think any of us, don't think of the lab as being an essential pillar of the work, but how have you seen the perceptions and the engagement change?
So the lab has always just kind of been in the background, running some tests, maybe often described as kind of a black box. You send the sample in, a result comes out a couple hours later. I think due to this pandemic, the lab was really brought to the forefront. We were right there from day one in the command center with our senior leaders, both administrative and clinical leaders. As Dr. Wojcik had mentioned, we had built trust over several years with our clinical teams, with our administration, that we could deliver on asks that were made of us. And we really did come through with COVID, being able to deliver in-house testing and then this pop-up laboratory as well. And as she's mentioned, why we're building an entire replacement regional laboratory. So they had a lot of trust in us. They were confident that we could deliver on multiple entities, be able to function and really concentrate while we're multitasking across several large projects. The ability to perform the lab testing really was critical, especially in those early days where clinical teams are deciding whether patients can be admitted, where they should be admitted, can they do surgery, do they have to postpone surgery, do they need to be isolated, what type of PPE they had to wear, especially in those early days where there were such shortages of really critical supplies like face masks and proper gowns and other PPE. The fact that we were able to deliver in-house testing really saved a large amount of dollars when you look back at it from an operational standpoint or from an administrative standpoint, where we did not have to rely on sending tests out to reference laboratories. We'd have to worry about that turnaround time that was days, and some of those early days was into weeks. And we were able to deliver these turnaround times in 24 hours, 36 hours, which really facilitated patient care and really, again, brought the lab back to the forefront. We were able to provide much needed service at a really critical time in a way that, was respected by our peers across the hospital.
At the same time, we do realize that it's not going to last forever. And we have seen this. At the beginning, when there was a testing, we were definitely number one. And I always keep joking. And our senior leadership meeting started with our seniors praising lab and praising me. The moment vaccine started, we were already in the background. So this is as everything always in life. We have to keep reminding everyone, any opportunity we have to remind that's what happened and that's what we are capable of, and that's what we do. Our job is to make sure to stay visible.
No, absolutely. And I think that part of that visibility that you mentioned can really be seen, I think, through some of the communication efforts. And I know when we talked earlier, you talked a little bit about how your communication sort of changed throughout the pandemic and, starting meetings with the the lab being in the forefront when testing was so essential to the ability for your organization to move forward. How have you sort of continued to evolve that communication pipeline and keep those connections, especially across the clinical and the administrative teams, and really help enhance your work through that?
Again, we always have to be simpler on the agenda, not only at the time of COVID, because again, this is not the only test which we're doing. And really kind of on the regular basis to show the number of tests, what we are doing, what new tests we are providing. So the bottom line, we have to be all the time at the table, as I said, on the agenda. But I think it was a great eye opener for everyone. The pandemic truly illustrated clearly the value of the lab. As I mentioned before, there is no healthcare that can exist without us. And I'm not scared to tell this to everyone. No one can exist without us.
John, anything to add on the communication front and how you've used that to continue to work together most effectively?
The pandemic really opened up those communication channels where I think we had previously had those one-on-one communications or those communications to clinical leaders and administrators and senior administrators when there was something went wrong or when they were asking for a bit of information. And, as Dr. Wojcik had mentioned, we continue to keep those communication channels open. Every opportunity we are out and we do promote the laboratory. We deliver daily COVID stats still 2 years into this to our senior leadership team and to our operational teams, so they know where we stand with COVID testing, what our percent positivity rate is within our region, what the number of tests that we are performing. We monitor our testing supplies. We present what's our blood status, our blood product status, making sure that's in the green. And so we continue daily to communicate with these senior leaders, with our clinical leaders. And I think that's really enhanced our value. It's given an opportunity for many of our younger leaders to step up and have a presence with the senior leaders to really develop them internally. So it's been a plus. I think one of the few positives that came out of this pandemic is that the laboratory is there. The laboratory will work with you, and the laboratory will help answer your questions and then deliver those patient care results you're looking for.
Absolutely. It sounds like it's really just given you an opportunity to really show the breadth and depth of what the lab can do and how well it can support the continued operation of the entire organization. Again, start with you, Dr. Wojcik. Thinking about lessons learned and, as you think back on the last 2 years, what are sort of those key lessons that you learned in the process of doing this that are going to change maybe how you do things going forward, or lessons you'll take with you as you keep figuring out how to run multiple projects at the same time?
Well, it's really believing in our abilities. We are able to think outside the box. We are able to take calculated risks. We are very flexible and we can be very efficient. And I think that's really just to show that we are not afraid of any challenges. And there is plenty of those challenges these days.
John, what are those lessons you're going to take forward into your next set of projects and activities?
So I definitely agree with everything Dr. Wojcik said, and I would add that the laboratory teams really have shown a tremendous amount of resilience at all levels, working through a lot of challenging situations and challenging times where we were not fully staffed, where we had not enough people at times to really do all the testing that everybody wanted, but we were able to work through that and really come out successful. Additionally, the importance of preparations and business continuity. I think we take that for granted sometimes, putting that work in ahead of time so that we do have a plan when the next pandemic strikes or the next emergency comes up, so that we can rely on that versus creating that from scratch. And one last thing is that in the healthcare and in laboratories, we've been working towards being really lean, especially of supplies, looking in, one out. And then taking a step back during this pandemic, it showed that we had to be a little more flexible, a little bit more, I would say, not necessarily less lean, but a little bit more robust in what we maintained on site and our ability to have enough supplies to really perform the testing needed for our patients. Because there was definitely times during this pandemic where we either ran out of vacuum container tubes or we ran out of COVID swabs. And so how do we manage that? And so that supply chain, first in, first out, yes, it works for a lot of things, but then we also still need a backup plan for when it's not going to work.
I think that's a very, very good lesson to take forward. There are many places where some of those challenges might mean we just wait, but you're not in a place where you can just wait. You have to keep doing what you do because you support the entire team. Dr. Vojcik, John, thank you so much for joining us today and sharing your insights. I just want to give you one more chance. If there's anything I didn't ask about that you want our listeners to know about what you were able to put together with the pop-up, and I'm still going to use air quotes, pop-up lab. Let's start with you, Dr. Vojcik.
Well, I think it's the best time to say that has been just a temporary lab. That's just, again, show our flexibility. We are scheduled to close this lab right now because the circumstances are different. There is no so much needs. So again, theoretically, we should kind of try to hold on, but definitely not. We have to concentrate in the areas which are needed right now, and that's definitely not going to be the one. And I just wanted to say that whatever we do, we are a team. This is not one person or achievement or anything. It's a team effort. And again, we are all of us on the same boat, and we have to work together.
John, last words?
I would agree 100% with that. We definitely are a team working together and just remembering during these kind of challenging times that we need to recognize each other, recognize the hard work, and at times just recognize showing up to work and what that can do for the team and what that does for our patients. So just that recognition and not forgetting about that as we move forward.
I can't imagine a better note to close on, and let me express my appreciation since I am also close enough to be part of your service area. Thank you for all the work that you have done to keep us all safe. I'd like to point out that if anyone is interested in learning more information about the College of American Pathologists and our amazing speakers, please visit info.cap.org/healthexec. That's info.cap.org/healthexec. Thanks again.